اتفضل
مساء
يا
الخير
دكتور.
عليكم. شكرا دكتور علاء على التقدمه الجميله دي. اخويا استاذي الكبير ومعلمي ولازم الجا له دايما لو في عندي اي consultation. Thank you دكتور علاء. Today I will be talking about the role of electrolyte balance in dry eye homeostasis. I have a financial interest for this lecture. First of all, we have to start by defining dry eye. The Tear Film and Ocular Surface Society, the TIFOS, have defined dry eye as it's a multifactorial disease. So there are multiple factors playing a role in this dry eye, characterized by loss of tear film homeostasis and hyperosmolarity of the tears, ocular surface inflammation, and finally neurosensory abnormalities. So why do we consider dry eyes to be a big problem? First of all, it's a worldwide disease. Up to 50% of the population can be affected by dry eye. In the United States only, up to 16.4 million people are affected by dry eye, and this number is increasing day by day. In 2018, the financial burden of dry eye treatment reached up to 2.2 billion, and it's increasing every year on. The third factor for having a big problem with dry eye is that there's multiple risk factors that are being increased nowadays because of the modern day life, such as the allergies that are getting more and more common, the contact lens wear, the flight in aeroplanes, the air conditioning environment that we live in, the use of screen, the computer vision syndrome that we see nowadays, refractive surgeries, and last but not least, multiple drugs that cause dry eye. Most important and most famous is the isotretinoin for treatment of acne. The fourth problem is that there's a wide spectrum of presentations. The patient can be totally asymptomatic, having no symptoms and suffering from dry eye. And they have a full-blown picture of dry eye, such as the redness, the frothy secretion, the cupping of the meibomian glands, and the filaments, and also the bethode spots. All these are signs of dry eye, but there is always no correlation between the severity of the symptoms and the signs that's present. So there's always a conflict of diagnosis and misdiagnosis of such a disease. The fifth cause of being a big problem is that there is a wide variety of medication without a standard protocol of use. So have multiple drugs. For orchidia, for example, there are multiple formulations of the dry eye drugs. Most of them are bottled or multiple dose eye drops, and some of them are single dose without the preservatives present. So how can we choose our proper eye drop medication for dry eye? So to get this point, we have to understand the artificial tear properties to choose the right one in our daily practice. To start understanding this, we have to understand that the tear film is 3 layers. The first one is the most superficial one, which is the oily layer secreted by meibomian glands. And the most inner one is the mucin layer secreted by the goblet cells. And in between is the aqueous layer. And this aqueous layer has proteins and has also electrolytes. And these electrolytes play a vital role on the homeostasis of the eye or the tear film. To go into the pathophysiology of the dry eye, there is excessive evaporation of the tear film. This goes to hyperosmolarity of the tear film, and this leads to inflammation. And this inflammation damages the ocular surface. And damaging the ocular surface leads to glandular loss and dysfunction of the glands secreting the lipid and the aqueous and the mucin. And this leads to reduced tear production, and this leads to tear instability. And again, we're going to start the surface. Tear instability will lead to friction and causing more and more inflammation and damage. So this vicious circle goes on and on and on and on. So in order to treat this, we have to interrupt such a vicious circle. Alteration in the tear film homeostasis by itself lead to ion or electrolyte imbalance. And this can be by systemic diseases, causes hypernatremia, such as diabetic patients, the patients with renal diseases, thyroid disease can have alteration of the electrolyte in their serum, in their blood. And we have also local causes that can affect the production of tears. All these external and internal causes lead to ion imbalance in the tear film. This ionic imbalance leads to the synthesis and structure ability formulation is being affected, and there is a lack of or disruption of the active transport of proteins inside the cells, and this leads to inflammation. This inflammation again augments the ion imbalance by affecting the transport and the reabsorption of the iron inside the cells. So this again is a vicious circle. The ion imbalance and inflammation goes on and on without treatment. Both these factors, the inflammation and iron and electrolyte imbalance, cause the altered tear film dynamics and leads to epithelial cell dysfunction as well as hyperexcitability of the neurons, and this gives the signs and symptoms of the dry eye. So again, the electrolyte acting as a key role in controlling and in maintaining a perfect homeostasis for the tear film. We've all known such a classification. Dry eye can be classified into evaporative disorder or aqueous deficiency disorder. In the first one, the most common one, the evaporative disorder, there is hyperosmolarity of the tear film. The water evaporates, leaving the electrolytes, and there is hyperosmolarity of the tear film. And in order to correct it, we have to increase the tear volume to replace this hyperosmolarity. And in the aqueous deficiency part, can cause by hypoosmolarity of the tear film. How can this occur? If there is cells producing the aqueous itself is malfunctioning and there is decreased production of the aqueous, it will be also associated by decreased production of the electrolytes in the tear film. And this can be restored by restoring the electrolyte in the artificial tears that we can supply. The tear film osmolarity ranges from normal between 280 up to 320, and the dry eye hyperosmolarity or the hyperosmolar state caused by the dry eye can reach up to 380. So we want to restore the osmolarity in the blue curve, not in the red curve. So what about the key electrolytes present in the tear film? We have lots of electrolytes, mainly sodium, chloride, potassium, calcium, and magnesium. There is a phenomenon called ferning. What's ferning? The ability of the tear film to dry in low humidity and low temperature to cause like crystals. Again, also some of the eye drops that we use in our eyes have this ferning ability. So if you have a look at this column, we have different artificial tears, and they are forming the crystal when they cause the fern. And you can see that the crystals are large, and sometimes these large crystals can affect the quality of the sensation of the patient. But when we add some of the electrolytes to these ferns or these artificial tears, the quality of the ferning improves a lot. So adding electrolytes to the artificial tears can improve the quality of the ferning, the quality of the crystal formation, and the quality of the sensation of the patient if you have the proper medication. Again, most of the lubricant eye drops focus on the viscosity enhancement to provide temporary relief by temporary lubrication. But we also have to focus that instead of artificial tear, they should be focusing on restoring the tear film homeostasis as a whole, not just the viscosity replacement, but the quality of the tear film as a whole. The financial part of talking about this topic is talking about one drug per se. It is the SoloFresh eye drop. It is one of the most powerful eye drops in the market. It has sodium hyaluronate, and this active ingredient is very important because it has dual action. During blinking, the viscosity of this sodium hyaluronate is low, so it can spread on the whole corneal surface. Again, when there is in between the blinks, the viscosity is maintained, and this leads to long-lasting effect on the corneal surface. So the viscosity is low to spread on the surface, again, and when in between the blinks, the viscosity is good enough to maintain the stability. Also, this sodium hyaluronate has high molecular weight, and this high molecular weight has been proven by research that this improves the corneal epithelial healing. So this sodium hyaluronate has dual action, the viscosity action, and also the healing action. In addition to the sodium hyaluronate in the SoloFresh eye drops, we have also polyethylene glycol 400. And the combination of these replace the tear film volume. So this volume of aqueous deficiency is now being replaced by something that absorbs water and retains this water. So we are restoring the osmotic balance by restoring the volume of the aqueous. Again, we are improving the corneal sensation and the corneal integrity. There is improvement of goblet cell density, and there is improvement of ocular comfort and relief of irritation. Combining these two active ingredients in dry eye treatment leads to better hydration, comfort, water retention, as well as lubrication. So combining these active ingredients to help the relief of the aqueous deficiency and also the irritation element. But the key factor we're talking about is the electrolyte imbalance. So we have to replace the electrolytes. So also SoloFresh has electrolytes in it. We have also in the SoloFresh, we have sodium. This maintains the osmotic pressure of the tear film. So we are talking about the blue curve now, not the red curve of the hyperosmolarity state of the tear film. The calcium itself plays a role in epithelial surface adhesion and improves the mucin stabilization. The potassium is essential for maintaining corneal thickness and the density of the conjunctival goblet cells. Magnesium support the tear film consistency as well as the intercellular junction. And finally, the chloride plays in regulation of the pH element of the tear film and also support the tear film structure. So these key 5 electrolytes restore the homeostasis of the tear film. Also, it's important to note that the preservative is an important element of any eye drop. And with the benzalkonium chloride medicated eye drops, we have irritation with prolonged use. Here, the preservative is not benzalkonium chloride. The preservative here is purite, and this purite sterilizes the eye drop while it's inside the bottle, and when it's put in the eye, on the eye of the patient, it converts into water and oxygen. So there is no benzalkonium chloride irritation, so it's going to be safer on the corneal surface, and we have less irritation. To summarize, the SoloFresh really was successful in breaking the vicious circle of the inflammation. It corrects the hyperosmolarity, it corrects the inflammation, it corrects the damaged ocular surface. The granular loss is being also treated, reduces the film quality and the tear film instability. So we have with this drug multiple action. And this is a short video that has been given by the Orchidia company to summarize the action of the SoloFresh as lubricant in the market that's effective in treating the hypoviscosity state, hyperosmotic state, and also the irritation of the dry eye. Can you increase the volume, please?
SoloFresh is powered by electrolytes, inspired by intelligence to support natural consistency of tear film. Electrolytes help replenish the tear film profile and support a more physiological tear environment. Sodium hyaluronate supports hydration and comfort, while polyethylene glycol 400 enhances lubrication and retention. SoloFresh mimics the natural tear environment, helping restore hydration, balance, and tear film stability. Designed for lifestyle-induced dry eye patients affected by digital screens, air conditioning, contact lenses, pollution, and environmental stress. SoloFresh, more than lubrication, a formula powered by electrolytes, supported by sodium hyaluronate, plus polyethylene glycol 400.
Thank you so much. Thank you, everyone.
شكرا جزيلا
Thank you,
يا
Dr.
إيهاب. امتى بتحول البيشنت بتاعك ان هو يقيس بقى؟ انت عارف في الاجهزه اللي هي بتقيس لك
Dry eye.
الدراي اي وبتطلع لك ده كده او كده او كده، امتى بتلجأ للقصه دي؟
هي مشكلة الدراي اي ان هو ال correlation between the symptoms of the patient and the signs are not even that close. Sometimes patients with mild signs have great symptoms. So when a patient is not comfortable with a simple eye drop that you're using in your practice, you send the patient for the dry eye evaluation. And accordingly, if there is hyperosmolarity state, we are going to shift to a hypoosmolar eye drop and trying to restore the electrolyte imbalance in such eyes. Okay, and there's always like a scheme going from 1 active ingredient to 2 active ingredient to 3 active ingredient or multiple active ingredients. Again, also we combine these eye drops with the IPL treatment and improving the quality of the tear film by improving the meibomian gland secretion from meibomian glands. But this is guided, as you were saying, Dr. Ala, with the dry eye assessment.
شكرا جزيلا
Thank you.
يا إيهاب.
Thank you.
شكرا جزيلا، اتفضل.